We will pivot a little bit now because you went on, I'm going to use bracket holiday.
Yeah. It was a vacation.
It was a vacation to Korea.
Yes.
And Japan, but we're going to talk about Korea probably more. And it was kind of a work trip because it was kind of research.
So much research.
So much research. So I don't know what's holiday idea.
Oh yeah, it was exhausting.
It was exhausting.
Yeah, like between Olive Young and the clinics and
all the
Korean barbecue.
It was research.
It was so hard.
So how long were you actually there for in Korea?
So in Korea, the whole trip was like 10 days and we did 5 days of Japan and 5 days of Korea.
So in 5 days, you got a lot done in Korea. So so Dr. Alia is a skincare junkie and she also likes to try things.
I do.
For research purposes.
And I'm going to make you try things.
And she's going to make me try things too. We all know I don't like to try things.
But he's going to try.
I'm going to try.
Yeah.
So what did you try?
So one of the things that I tried was, obviously I did a lot of research.
She did her research beforehand.
I did research beforehand.
Very good.
And I went to a clinic in South Korea.
Okay.
Which was in Gangnam, so it's like a good area.
Yeah.
It was also not cheap. No, people think like you go to Korea and you obviously it's not.
I mean, how much are we talking? Like, I mean, we can talk on that at the end when you tell us what you did and what the price tag was, because I'm really interested to know the price aspect of this.
Yeah.
But we'll talk about the price when you tell us what you actually did.
Okay. Do you want to know what I paid now or later?
We'll do it at the end. When we know, we can all start thinking about what did she pay for this?
Why did you have?
So when you went to the clinic, you obviously made an appointment at home for it, and your husband went and had stuff done too.
Yeah.
But when you went to sit in front of this doctor, who I think must have been a dermatologist. Yeah. The lady. Yeah. What did you tell her you wanted?
So the interesting thing is when you make the appointment for this clinic, they're tailored. I mean, it's a very big clinic. They have one whole floor for international people, patients, and one for Koreans, because there's a little bit of a language barrier. So they make sure that the doctors who are working with international patients speak English.
Yeah, good.
No?
Good
so
point.
that's very helpful. I mean, just on a sideline, I went to Japan to a head spa and nobody spoke a word of English, which was quite tricky, but it was fun as well. So
yes.
It was very relaxing. Anyway, also research. Only research.
Yes.
So when I made the appointment for this clinic, they sent you a questionnaire and ask you what are your skin concerns. So basically what is it that you're interested in? What are your main concerns? So basically they already screen you beforehand in terms of what is it that you want.
And they list all their options?
They list all their options and you can also write. So for example, I do suffer from rosacea, redness, skin aging. I'm turning 40 very soon and, fine lines
in 2 weeks.
And the
big 4-0.
The big 4-0.
Oh, goodness.
I like to think I don't look it, but I think every millennial thinks that. So
you definitely don't. She doesn't look 40.
Well, I do. Anyway, so I did all this and then you arrive there and then they do a skin analysis for you where you get this really fancy machine where you suddenly see all your red spots and pigmentations.
Yeah, I think they use a Vizio.
Probably. I can show you. But I mean, I know even sometimes in certain iPhone filters, you can see all your pigmentations. And I know I do suffer from melasma and pigmentations and things like this. So, and the fine lines and everything. Anyway, and then you go into the consultation with the doctor and they really do a detailed analysis of the things that concern you. They look at the pictures and then they give you options of things that can treat certain areas, right?
Okay.
And then you can decide what you want to do.
Oh, God.
Right? You could end up spending a ton of money, really like 20, 30,000 dirhams. Or you say, okay, this is my main concerns. Let's do those things.
Right.
And there was one particular thing I was interested in. This is also why I chose that clinic, was stem cells.
Stem cells. Mm-hmm.
So, stem cells, great for rejuvenation, collagen, and so on. And we use PRP a lot here, which has, some growth factors. Now very popular, and I think it's probably the best is fat, right? Where you
get stem cells.
Exactly, where you get your fat stem cells and re-inject them. You use microfat and nanofat. Microfat more for volumizing. So this is what a lot of oculoplastic surgeons also use to revolumize the face. Nanofat more for the growth factors and the rejuvenation of the skin itself. But they do it with the blood. Yep, so you get a ton of blood extracted.
Like a ton.
It was really that much. And
like 20 mils. It was about 20 mils.
Probably, yeah. But it was a lot.
It was a lot.
And then they work it in their machines.
They do something to the blood.
They do something to the blood.
To extract the stem cells.
Exactly. And then you get them re-injected into your face.
Oh, so we have some pictures.
Yeah. You want to see that?
We want to see the pictures. So, but that was the first thing they did.
Yes.
Right.
No, actually, thermage was the first.
Okay.
Thing.
Yes.
Because
thermage. Yeah.
So because research, equiloplastic, and fine lines and wrinkles and so on, and we need to work on the collagen. I had thermage.
So only under the eyes.
Only under the eyes.
Yep.
They also told me I can have it for my jowls, but that would have pulled up my bill too much. So I was like,
thermage is super expensive.
Yeah.
But you also have a very tight jawline. So like,
I mean, I do, but I also get a little masseter also because I bite a lot, but that results in me having a little bit of a jaw here.
Okay.
You see this?
Yes.
You see my
I see her jowl.
Do you see?
It looks just horrific.
It's horrific.
It's horrific. Yeah. You can always do something about your masseter.
Honestly, when you
You can do your masseter though.
Oh, I do masseter Botox.
With the Botox, okay.
Yeah, because I bite a lot.
Yeah,
because otherwise I get a square face.
Yeah.
So honestly, I think also when you live in Dubai, right, you do get very Dubai'd, right? Like I think when I was living in Germany, I mean, you don't do
You were less critical of yourself. Yes.
You become much more relaxed about stories. But even there, it's changing. Like even Germany is changing. London, different story. In London, people love that, especially when you work in Harley Street. But in Dubai, I think it's a little bit extreme. And it's nice to find a little bit of a balance, right?
Yeah.
So I think the goal in aesthetics should not be to change. It's more to enhance and to take proper care of your skin.
Yeah.
Right?
Totally. Yes.
So
thermage first. So we don't know the result of the thermage yet.
Yeah. So thermage takes a while. So they say it gives a little bit of an instant lift. I don't know. Might be all the Korean creams that I sampled.
Yeah.
As well. But we'll see in a few months. And apparently it's something you do once a year. It was really not painful at all. I was numbed all around. It was not painful. It was a very pleasant experience. Stem cells, less pleasant.
So stem cell injections into the entire face using a needle. So
I had all those needles. Can you see them? And that was me slightly scared.
I mean, that's like how many 1 mil syringes?
Yeah, like 5, I think.
Those are 1 mils.
Yeah.
Yeah, well, five mils.
And this was, okay, let's see something more. Yeah. And they really do all those bubbles into your face. So it's quite scary and painful.
Oh, God, yeah.
But I'm going to look like a baby. I mean, I asked him, I better look like 25 after I'm done. He was very honest. He's like, that's going to be a little bit difficult. Very honest review. I was like, oh gosh, why am I doing this?
So stem cells first, then
So I did stem cells. Then I did a mixture of polynucleotides and hydration skin boosters.
So the same, so like hyaluronic, maybe. Hyaluronic?
Like a little non-cost things.
Like Volite or something.
Yeah. So they kind of mix this together and put it in one.
Again, all injections?
All injections.
The same way?
Face and neck.
Face and neck.
Face and neck.
But this was all in one session. So thermage, stem cell, then
first thermage,
the
then the stem cells, then the polynucleotide. And the last thing that I did is something that I did because I wanted to reduce the pore size and kind of get a more glowy skin was skin Botox.
So these are micro injections of Botox into the intradermal injections.
Yeah.
Yeah. So that's something I've actually done to patients before.
Actually, I think it's really, I mean, the effect we all know is not long because it's hyperdiluted Botox.
Yes,
So
it's hyperdiluted Botox.
It's not like the muscle Botox when, it lasts you good 3-4 months.
I've done it to myself as well.
Yeah.
So for redness.
Yeah, I think it's a nice thing. I do think my pores look smaller.
But I don't think it's a long-lasting treatment.
It's probably going to last a month or 2 max. Yeah. But, as I said, I'm turning big.
We have 2 weeks.
So
for the big
I want to look nice for that.
Right.
So it's nothing you do for a very long-term effect. So this I knew is short-term. No? So that's what I did.
So there was a whole bunch of things injected in one go. And then starting with the thermage. And so what was the price of this whole thing?
It was around 10,000 dirhams.
So that's a lot, but that's pretty much what you probably pay here. I think the stem cells are more expensive here.
The stem cells is definitely more expensive, and also the thermage. So the thermage is more expensive.
Yeah.
It's because it's like they count it, and they also give you like a little booklet and make sure it was a good clinic.
Yeah.
So I think the thermage was around 2,000, 2,500, and I think it's
cheap,
more
I
here.
think. Yeah, that's.
I think the thermage was around 2,500. The stem cells also.
Okay.
And then, the other things.
Yeah, the other things.
I don't know.
So that I probably would have cost double that here.
Yeah. Probably.
in total. Yeah, because stem cells are expensive.
Yeah.
Okay. And we don't have a verdict yet, though. It's
No,
literally
because
been
it's been 1 week.
Literally a week.
Just 1 week. And so after the treatment, I looked like I've gotten bitten by 1,000 mosquitoes. And I'm going to be honest, it was painful. Even though I had an hour of numbing cream on.
An hour?
Yeah, they made me wait a little bit, even though I told them I'm an oculoplastic. But anyway,
I can handle the pain. Yeah, I'm an oculoplastic surgeon.
So I had it an hour on, but it was still painful because intradermal injections.
Is it painful? Yeah.
It hurts.
But even with numbing cream, it hurts.
Exactly.
So it's the pressure through the dermis.
I think maybe they should have put like a block or something. That would have been better.
A nerve block,
right?
That would have been good.
Yeah, nerve block would be nice. So if you're ever gonna start offering, maybe give a nerve block.
Yeah, I'll get to it with a nerve block.
Right. So
with this, it's interesting because microneedling or percutaneous collagen induction is not a new concept. So that's been around for decades and decades, and that's been shown histologically to improve collagen and so on. So with any of these treatments, me being the skeptic that I am, and the lack of kind of strong evidence base we have for a lot of these things, is thinking, okay, well, how much of this is the microneedling itself, and how much is what you're microneedling in? So we don't know.
We don't know.
And we'll never, you cannot do this.
Yeah. But do you microneedle alone or do you always use something?
So I don't do any microneedling.
You don't do any microneedling?
No, because I use CO2.
Yeah, well, that
I
makes
have
sense.
better things to do with people's faces. But I don't also do full face skin boosters, like where you go with the volite or whatever and you inject the whole face. So I actually don't do that because I think it's very painful. And I also cannot, for myself, separate the effect of the needle from the treatment itself. So, but microneedling has to cause you to bleed, and you did have bleeding.
Yeah, I mean, they did it with a microinjection, so they didn't use the actual microneedling machine.
Yes, but they use syringes, no?
Yeah.
Like little, like probably a 4 millimeter needle. Yeah, so like a Botox needle. But you did have pinpoint bleeding.
Yes,
and it was painful.
It was painful,
and it has to hurt, and it has to be painful because otherwise you're not in the right part of the skin.
Exactly.
So when you're using those tiny little like dermal rollers for microneedling, where it doesn't really make you bleed and you don't really feel it, that's not going to do anything.
I mean, those ones I would never use.
No, that's totally
I find the idea of those rollers terrifying.
Yeah, terrifying. But they're too superficial. They're technically not going to do what microneedling is meant to do because it's not going to hit the right part of the dermis. But yeah, so with these treatments, I want to know what it feels like. But have you ever, what it's going to look like with you, but have you ever had actual microneedling with nothing?
No.
See, what it would be fun to do next time.
Let's
I'll go with you next time and I'll tell them what to do. Is to do half your face with all the injectable stuff, and then half your face just microneedling.
Like, but don't you need anything to kind of?
You can microneedle saline.
With saline? I was wondering this actually, if that's possible, because I never thought of doing microneedling, because the idea of microneedling itself is like, it helps, and there's research on it, right?
Percutaneous collagen induction.
Yeah, but I always think, okay, well, if we use a little bit of PRP with it should be better.
Well,
right?
Yeah. I can't recall whether or not I've seen a study where they've microneedled normal saline and then microneedled substance A or whatever, because it's very hard to blind that. But you can still blind it to the patient and the practitioner. I have to check. I don't think I've seen a study like that. I think I've just talked about doing a study like that, which we could do.
Yeah, it would be interesting.
Totally do that.
Yeah.
But you would definitely, the only way to really know, because also from what I can recall, and I haven't looked into this for a little while, is that a lot of the stuff that comes out histologically from percutaneous collagen induction, whether that translates into reality. So the enzyme that does this for whatever, blah, 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 collagen is, or the markers are raised after the treatment, but does that translate into a real life change? And that with skin, it's so difficult to quantify that because we do like plaster cast and like subjective views.
It's very difficult,
to be able to show that there's actually a change, especially if it's relatively subtle.
Yeah, it's often like, okay, what did the patients feel?
What do they feel?
Right? What they feel, because it's it's terrible. It's a terrible marker. It's a terrible marker. I mean, at the end of the day, when it comes to real, skin treatments like topicals, hydroquinone works. Tretinoin works.
Yeah. Azelaic acid works for some people.
For some people.
So Dr. Alia loves azelaic acid.
I do like it.
I'm not a huge fan, but fine. I'm open to the idea of using it.
We're going to try it.
I'm going to try it. I'll try it with some patients.
Second tube, I really like it.
And I also don't like combined tretinoin and azelaic acid, but I can do that in one cream. So if you do want that made, we can always make that for you. I can always have Fusion make it. But yes, I mean, certain creams, we know they work. And you can see the visual change. And with these types of treatments, I'm always a little skeptical because I don't know if you can see the change that easily. With CO2, you can see the change. You know,
and I do think CO2 laser is one of the best treatments around. Like, you know, for skin tightening, I always tell my patients, especially after lower blepharoplasty, you know, I'm not a huge, also, you know, trends, right? The patients come in, can't you remove some skin, right? We do the lower blepharoplasty from the inside of the eyelid.
Which is so cool, but yeah.
because you can do everything from the inside, and it's much safer because, you know, when you see those old horror stories, not even old, like where you have the patients with the pulled down lid,
the
horrible complication, which mainly happens, you know, when you remove too much skin or when you went through all the layers and then there's scarring and so on. And when we do the lower blepharoplasty from the inside of the lid, one of the nicest things is that we don't have a scar from the outside, so you can't see anything. But then, you know, a lot of patients are like, oh, but then I have all this hanging skin. And yes, some people do. So if you do have really excess skin, then yes, you can do a skin pinch. But a lot of people think like, oh, when I smile, I have lines. Yeah, everybody does. I mean, you also have lines on your elbows.
Children have lines when they smile.
So they are there because, you know, there needs to be movement. If everything was tight, then your eyelid would pull down. Some people actually have excess skin, and then you can take a little pinch of skin and you can tighten that up in certain patients. But most of the patients, I actually tell them, well, after it's done and you feel your skin needs a little bit tightening, go for a CO2 laser.
And I can do it because you're letting me do it to your patients like the day after their blep. Because you might as well recover from all of it at the same time. Because it doesn't matter to me if you've had an inside the lid thing, because the swelling will be there anyway. It doesn't change how I do it if you have swelling. So it'll just mean that you have a little more swelling.
You have a little bit more swelling, but it's so good to tighten the skin.
And you might as well just do it all at the same time. And when I do lower lids, I mean, I can put an eye shield in, but I don't have to for lower lid because I just pull the lid down. But I think, you know, would you like me to use an eye shield?
That makes sense.
Okay, fine. We use eye shields for your patients. Eye shields is fine. But yeah, so there's different ways of doing it, but that's cool. But yeah, I mean, I think so there's certain things that we know work, and I with my experience of it, with your experience, you can see an immediate improvement. So that's why I'm a little skeptical, but I'm gonna want. I know what your skin looks right now. So I have.
I do have makeup on.
You do have makeup on, but I can still see through makeup, and it's gonna be ingrained in my brain. So when I see you in like 3 months to check. See what your skin, because it's probably going to take that long to see it.
Triage takes good 3 months.
Yeah, it takes good 3 months.
I mean, the Botox effect will be gone. Right? But the stem cells, probably after a month or so, it will start to show more. I mean, you know, with all those things, call it maintenance.
Yeah, call maintenance. We'll call it maintenance.
Yeah.
I think just to get us to wrap up this podcast, chat. So if you've been watching this far, great. But that's been super interesting because I also had Pallavi, the designer for the clinic. She also went to Korea and but she had a bunch of lasers done as well. So that's, I might get her on the podcast to talk about that. But she had like Sculptra and stuff. So
what do you think about Sculptra?
Yeah, I mean, I've not done it for the face. I've used Sculptra and Radius for like skin laxity in the abdomen, which I know is a bit random, but hyperdilute Radius is quite good for that. I'm not adverse to it, though. The part of the reason I've never done it in the face is because I've dealt with a lot of complications of it. So lumps, a lot of lumpiness, and just all along the jawline lumpiness, intraoral lumpiness, like weird stuff. So I think that's put me off doing it to people's faces. So I'm sure if I did it, it might be fine. But I mean, have you used it? No,
I haven't used it, no.
Yeah, I mean, I'm a little bit, old school and maybe a bit behind the times with this, that I haven't actually used that on a patient's face.
But there are a lot of complications.
There are a lot of complications.
Right, so that's the thing, and I know of a lot of dermatologists say, "Oh no, we don't do Sculptra," and you know, there's a lot of plastic surgeons who's like, "Oh, it's bad because it causes all the scarring, and then you can't have a facelift." But I don't know if that's.
I don't know if that's true. And when I speak to some plastic surgeons, I'll ask them. But I would never want to do something to a patient which means they can't have a facelift, because I do. I'm a huge fan of facelifts. I don't do the facelifts done right. I don't do them myself, but I'm a big believer. I'm a big fan of surgery. Basically, I should have been an oculoplastic surgeon. I should have, because I'm a big fan of all that stuff. I think you always want to do the stuff you can't do. So I always want to be a surgeon. So what I was going to say is some practical stuff. So when a patient says to you, "What's the best eye cream?" I mean, that's a very general statement, but is there any brand or commercial part of eye? No,
because it always depends on the concern.
Okay,
right. So what is your concern when it comes to
fine lines? Easy.
Yeah, tretinoin.
Tretinoin. Yeah, but and then they're like, okay, no, but is it safe around the eyes? Yes. We did talk a little bit earlier about dryness around the eyes from tretinoin. I think you have to put a lot of it on near the eye.
Yeah.
To have a dry.
People are super scared of tretinoin around the eyes.
Yeah.
And honestly, no, it's not a problem. You can. If you are a little, because the skin obviously is very thin. So I usually tell them put some moisturizer around and then tap a teeny tiny amount around here, right? Where you have it. It's
but you can put it here.
You can.
But you might get dry.
You know, just really little, because when it comes to tretinoin and creams in general, people think they have to take the tube, right? It's really important to tell them, like, 1 piece size is for the whole face. And when we're talking about the eye, it's even less. So even less, basically, a
little bit. And what about like caffeine based?
I mean, for depuffing.
Does it work for depuffing?
I mean, caffeine can depuff, but usually I tell them put it in the fridge, then it's cold, and then it can help a little bit more. It's probably the coldness that helps, but you know, why not?
Cucumber slices.
Yeah, I mean, why not? You know, like at the end of the day, when it comes to eye creams, we have the actives, right, that actually do something, and some things just make you feel better.
Yeah,
which is fine. I love my eye patches, even though they don't do much, but they make me feel better. You
don't actually use those.
Oh, I do. I do. I had one on just before I came. It makes me feel better. I have one with glutathione.
Oh, right.
And honestly, it gives a little, I do use them.
Do you think it smooths out the skin a little bit?
A little bit, yeah. And it makes your makeup go on better. It's just... We're gonna try them together.
Yeah, okay.
I bring you my favorite ones.
You can bring me your favorite ones from Korea, and I'll have a go, and we'll see how much more youthful I look.
A lot of skincare is also, and I don't know if you agree, at least for me, it's like it's a feel-good thing.
Yeah, it's like shoes.
Yeah, so some things, some things we do because we need to do them, like the tretinoin and hydroquinone and
azelaic acid.
And some things we do because they make us feel better.
Yeah. So yes. No, I 100% agree. So, and I do say that, you know, if you like a product or if you really love a serum or whatever, then just use it. Because I'm not, though I may think it's rubbish and not worth the time. What I think doesn't really matter because you want to buy it and you want to use it. Just like, you know, I can buy fancy shoes or I can buy flip-flops from Primark and they both do the same thing. Sort of. But I prefer to buy, you know, the red soled shoes.
I like the red soled
shoes. It's my personal preference. But I know that that's not necessary. You know, it's just because I like the way I feel when I wear them. Not always when they get, you know.
I think the only thing I tell my patients not to do is like, you know, products which have a lot of perfumes in them. Oh, yeah. So because they cause irritations. Do you agree?
Yeah. If you're sensitive to that, yes. Yeah. A lot of the higher end, more expensive products have that. Lots of fragrances. So if I mean, I don't like using creams with fragrances because I don't like it. I don't like the smell on my face. Yeah. So, but again, if you use a cream like that and you've always used it and you've always loved it,
with it, then it's okay.
Then whatever, you know, fine. Yeah. So, I mean, to me, all skincare is pretty much the same. The price points differ and the level of fanciness differ. Just with shoes, the same. Yeah. You know, or car. I use the car analogy, but people don't like that because I don't know anything about cars. So I'm like a Toyota or a Nissan Sunny and I don't know, Porsche something or other will get you from A to B the same. We'll get you to A, maybe not the same, but we'll get you to A and B, A to B.
It's a little more comfortable.
It's a little more comfortable, and you might feel cooler or better or more swoosh in the Porsche. But in the end,
you feel safe.
Cars, I don't know, dude. God. I mean, a car is just a tin can. Do I feel safe in any car?
I feel safe in some cars more than others, especially in Dubai streets, right? Like I don't want to drive a small car in Dubai streets because I think they're just going to drive over me.
Yeah, I have that feeling. I used to drive a really old Volkswagen Beetle here.
Oh, really?
Yeah, that was bad. Yeah, that was a bad
I like to drive big.
Yeah, I have a big car.
Big cars.
You have a big car too.
I have a big car. I
don't
like small cars.
Okay, fine. But like, let's say, let's choose a cheap big car and an expensive big car. The expensive big car and this cheap one will get you to the same place.
Yes.
And you might like all the little bells and whistles in the expensive one. A little bit, but it's a feel good thing, just like skincare. But right, so when people say what's the best eye cream, it's like, well, depending on what you need it for,
depends on your concerns,
and you know, all the trendy skincare stuff, like with all the weird ingredients on it. Well,
PDRN.
Yes,
I like it. I'm gonna get you to try it.
Yes, I'm gonna try it.
I like to try things, to be honest. Like I'm fine.
Yeah, I should try things, but I'm kind of like, oh, can't be bothered. Because
maybe you should go to Korea to try things.
I think I should go to Korea, and can I film stuff? I'll take the
crew,
and we'll all go.
A whole crew. I'll come with you.
Yeah, we'll go together.
I'll try to
you
for research.
You can make me do stuff for research.
Exactly.
Just so we don't pay income tax, so we can make it tax deductible if it was like a work trip.
Oh yeah.
But we're in Dubai, so
we don't pay tax.
We don't pay tax.
But you know, everything
Yes.
there is tax-free anyway.
Oh, is it?
Yeah, it's great. You go to Olive Young, which is like the Sephora of Korea. It's amazing.
It's amazing.
Oh, it's so good. Anyway, so you don't even have to do the tax refund at the airport.
Because they don't charge
You just give them
VAT.
your passport,
Oh, right.
and they do it immediately.
That's what they do in Japan.
Yeah, in
They
Japan
just
as
take it
well.
off of
Yeah,
the thing.
amazing.
Yeah, we should do that
It's
here.
great. They should do that in Europe.
They should
Europe,
do
I
it
still
here.
have to do the tax refund.
Even the UK, you can't even do it anymore.
No, it's really annoying.
Anyway, that's a different. Political problems are not our conversation today.
Well.
All right, well, great. That was a very fun podcast. Thank you so much for coming.
Thank
and
you
we'll do
for
another
having
one where we're actually going to take all your skincare and have a look at it.
Yeah, I'm gonna bring my Olive Young bags, and then we're
we'll
gonna
spread it
try
all
them
out.
out.
And we'll see what happens. Yeah, cool. All right, thank you so much.
Thank you so much for
Thanks,
having
guys.
me.
Thanks for watching.
Thanks.
Till next time.